Hello and welcome to Health Hot Talk, and I'm your host Connor Sandiego. And here with us today for our last guest of the show, we have Dr. John Berezniak from James Madison University.
Pleasure to be here, Connor.
It's a pleasure to have you with us. So, Dr. Berezniak, your recent article in Life Extensor magazine has sparked some excellent dialogue within the health community. Some taking the pharmaceutical industry side, and what I'd like to say is the majority calling for action against big pharmaceutical companies. Now, what we have here on the Health Hot Talk broadcast want us to know, what was the urgency to write this article? Or in other words, why was it so important for you to get this information out now?
First of all, Connor, I'd just like to say that this is an incredible studio you have here. But to answer your question, there was no doubt in my mind that I needed to write and publish this article as soon as possible. The healthcare field has become so corrupted with the pursuit of the almighty dollar, as I like to say, that healthcare providers are losing sight of what their actual purpose is. American pharmaceutical companies have adopted this capitalist way of thinking, where greatly exceeding the bottom line holds priority no matter the how.
Some of the specific examples you use in your articles were Valeant Pharmaceuticals and Pfizer, yes?
Yes.
Okay, and how have these companies specifically contributed to the issues that you're talking about in your article?
Big pharmaceutical companies like Pfizer and Valeant have sadly followed the same trend as many other drug companies by purchasing what are unfortunately labeled neglected drugs and reclassifying them as specialty drugs, while drastically increasing their price. Now, the label neglected is in reference to how these are not common generic drugs that can be beneficial in a variety of cases, but are specialty drugs for special cases and patients. The sad part is the majority of the times these patients have compromised immune systems consistent with HIV and AIDS, and also some cancer patients. The state of vulnerability leaves these patients no choice but to comply with the demands of these pharmaceutical companies, since the alternative would be risking their lives with less effective drugs or therapies.
Wow, these are undeniably serious issues we're talking about. With these final few moments we have left, is there any final comment that you want the audience to take away from this broadcast?
The most important thing to remember when approaching this issue is remembering who these patients are and what the time frame is. A delayed resolution to this could result in us counting deaths rather than dollars. Time is of the essence, so go out, demand change from your politicians, and fight for what is nothing short of a humanitarian issue.
Well, Dr. Berezniak, thank you for joining us. And that concludes today's show. Our broadcast will continue on weekdays from 12 to 5. Join us next week on the Health Hot Talk Radio for our analysis on the opioid epidemic in America. Thank you.